Family Dental Clinic.
You're watching Vancouver Television.
Is straight teeth, like good straight teeth, is that genetics or is that like treatment?
So, the way the teeth are placed is a very multifactorial thing. It doesn't belong only to genetics. Environment plays a very important role in that. Moss's theory, if you're aware of it, says environment plays a major role more than the genetics sometimes.
Because my mom has poor teeth, my dad has good teeth. And considering how I've been lucky, I always like thanked him and kind of dissed my mom.
No, not at all. It could be that you have inherited the good of both rather than inheriting one bad and one good. So you have a perfect DNA combination.
So how do you know when, like I find that root canals is when you feel pain that you come for a procedure. Can you prevent that at some point? Like, how is there a preventative measure?
In general, there are times when a person comes in with pain and the cavity or the bacteria have encroached on the nerve, and then once it's touched the nerve, there's no other way but to do a root canal. So I get people who come in with pain and I look at the x-ray and it needs a root canal and they say, "Doc, can you just give me some medicine? Can you make it go away?" The medicine will only calm it down for 6 hours, 8 hours, but it will come back. Sometimes it works for a couple of days or weeks and they think the problem's gone. Again, they're correlating problem with the pain. The problem is there, it was there even before they came in. So the answer to that is root canal.
So root canal is like going. Like,
so you go inside, you take the nerves out, depending on.
you take the nerves out.
There's fine nerves of in every tooth, depending on how many roots there are. So they're very fine. So nerves is a technical term. Basically, it's fine fibrils that convey pain to the brain. So you take them out and then you clean that space and you seal it. So that the tooth stays in the mouth. You can use it for chewing, but you don't feel
the inside of
the center core is gone.
Do you fill it with something?
Yeah, you seal it up.
That's
So it's a brilliant way to retain your tooth and give you a second chance of looking after your other teeth so that it doesn't follow the same fate. So if you had a root canal, it means that you lapsed big time in your previous years.
like eating habits sort of thing?
Not eating habits. Most people think, oh, if I'm eating chocolates, I've got cavities. No, eating chocolate is fine. Do that sin, but floss after that. Okay. So most people will eat chocolates or keep on chomping, but they will not clean it. So if you want to eat 5 times, you go and brush 5 times immediately. You'll be fine. You can eat as much as you want. So you correlate grossly that you're eating chocolate, but it's the specific cleaning, etc.
So if you say 5 times, can I actually brush with the toothpaste 5 times and that's healthy?
Yeah, that's fine.
It
it won't wear out your
the
enamel. No,
because there's that.
no. The modern day toothpaste and toothbrushes will not wear out enamel. Yeah, you can brush. I mean, you don't want to be using the hard toothbrushes and not excessive pressure, otherwise it will wear out. But
Just kind of like
gentle brushing.
Is there a dentist recommended toothpaste?
No, actually these days most toothpaste have almost all the good ingredients, unless you're looking for something specific. So if you have higher cavity rate or something, then you want to select something with higher fluoride concentration, which your dentist will recommend. But these days most toothpaste will have all the nice ingredients.
So there's no like specific one.
Not really. I mean, there's a lot of advertisement gimmicks and dentist recommended this, but in fine print they're all the same. It's all about technique and doing the right things. Flossing mostly.